Everyone wants to know how many people are recovering from COVID-19, but as we're finding out, that answer isn't so easy to come by. Viewers have frequently asked why we aren't sharing the number of Michiganders who've recovered from the virus. Well, the problem is that was not a number the state has been collecting and sharing.
That's right, but that has now changed, but it's raising brand new questions. Currently, out of more than 20,000 cases, the state only lists 56 as recovered. That might not sound right, but our Dr. Frank McGeorge is here to explain. The devil is in the details. Frank.
Yeah, Kim, so when you read the full statement below that number 56 on the state's website, it does explain that number is only being reported once a week, and it's from April 3rd, so there's one lag. And the numbers will jump every week. We expect that. But more importantly to understand, it is not an actual count of the true number who have recovered. The recovered number basically represents the number of cases whose onset was 30 days prior minus the deaths. It's really only a very rough approximation because, especially in the beginning before testing ramped up, the number of identified cases was way below the number of actual cases. Still, it will be good to see some estimate of recoveries in Michigan, even if it's just a rough estimate. Now, of course, that leads to a legitimate question that many viewers have asked. How long does it take to recover? Well, it partly depends on how sick you were to begin with. If someone finds themselves hospitalized on a ventilator, their recovery can easily exceed a month. For someone with mild symptoms, though, recovery can occur in about a week. Now, for purposes of determining when a person is recovered and safe to return to normal public activity, we use the guideline of 3 days beyond the last symptoms or fever, starting with a minimum of 7 days from the onset of illness. So, think of it this way. At a minimum of 7 days from onset, plus 3 days without fever or symptoms, that totals a minimum of 10 days. Now, for people who are hospitalized, the CDC recommends that they have 2 negative swab tests that are done at least 24 hours apart to demonstrate that they are free of disease, although the CDC also recognizes that the symptom-based criteria might be more appropriate when testing supplies are in particularly high demand.
Well, Frank, before you go, talk about all of the people who were never sick enough to be in the hospital and how those numbers might factor into this.
Yeah, so if you were not sick enough to have been hospitalized, you should use the symptom-based strategy to tell when you're clear to resume public activity. But the fact is, the state is not necessarily directly counting those people. They are basically getting an aggregate number based on the number of diagnosed cases and tested cases minus the deaths. So it's useful to see the number of recovered, but it is not a precise number.
Sure.
Back to you.
Yeah. Okay. Frank, thank you.